Hi, hello everyone. Welcome back to our channel Medical Coders Coaching World CPC. Today we are going to see about diseases of the circulatory system, which is the ninth chapter in ICD-10-CM. The code ranges from I00 to I99. The first topic here is hypertension. HD I wrote as a short form as HD for hypertension. HD and heart involvement and HD and kidney involvement, if this is linked by the word with. If the provider clearly mentioned that HD and other conditions like heart and kidney are unrelated, then we have to assign separate codes for hypertension and heart, or hypertension and kidney, or together like hypertension, heart and kidney, we have to assign the separate codes. If the provider is clearly mentioned that it is related, or if the provider is not mentioned any word like unrelated in the document, then we have to assign a single code for a combination code, not a single code, a combination code for hypertension and heart, hypertension and kidney, hypertension and heart and kidney, like that. In case in the classification, we will see the word in classification like with, due to, associated with, like these words are seen in the classification. In case in the classification doesn't have any terms like such as due to or associated with or with, then we have to ask the provider to mention clearly in the document whether the hypertension is involved with, related to heart, or uh, hypertension is related to kidney, or these both are unrelated. Hypertension and heart is unrelated, hypertension and kidney is unrelated. We have to query the provider to mention in the document clearly whether it is related or unrelated. And the next topic is hypertension with heart disease. The codes are I50, I51.4, I51.7, I51.89 and I51.9. These codes we have to assign from the category I11 for hypertension and heart disease. And we have to use additional code for heart failure I50 to identify the type of heart failure along with these codes. The same heart condition codes like I50, I51.4, I51.7, I51.89 and I51.9 are coded separately if the provider is documented that the hypertension and heart disease is unrelated. If the provider is document like this, then we have to code the heart conditions separately with hypertension. And the code sequencing will be depends on the admission of the patient or the encounter of the patient, which makes the patient to get admission to the hospital, or which makes the patient to visit the doctor, like whether the hypertension makes the patient to get admission to the hospital, or the hypertension makes the patient to visit the doctor, or the heart disease makes the patient to get admission, or the heart disease makes the patient to visit the doctor. Like this situation depends on the situation, the code sequencing will be depends. And now it is N18.1, N18.2, N18.3, N18.4, N18.5, N18.6. These 1, 2, 3, 4, 5, 6 are the stages of CKD, chronic kidney disease, and N18.6 is the ESRD, which means end stage renal disease. And if there is any acute renal failure with CKD, then we have to add additional code for acute renal failure. We have to add additional code for acute renal failure. The next topic is hypertension with cerebrovascular disease. The principal diagnosis is I60 to I69 category codes, which is for cerebrovascular disease, and the secondary diagnosis is hypertension. And the next topic is hypertension with retinopathy, which is H35.0, background retinopathy and retinal vascular changes. This code is used along with I10 to I15 category codes. The code sequencing is based on the encounter of admission or encounter of patient visit to doctor. Next one is hypertension secondary. It is there will be two codes for this. One is for underlying etiology. The first code is for one code is for underlying etiology to identify the underlying condition, and the second code is for I-15 category codes to identify the hypertension. The code sequencing is based on the encounter of patient visit or encounter of admission. The next topic is hypertension transient. In this, R03.0 elevated BP reading without diagnosis of hypertension, unless the patient has an established diagnosis of hypertension. This code should be given. Or O13 gestational hypertension, which is pregnancy induced hypertension. The hypertension is because of pregnancy. Or O14 pre-eclampsia for transient hypertension of pregnancy. These codes should be given for hypertension transient. And the hypertension controlled. Hypertension controlled means hypertension is controlled by any therapy like drugs or pills like that, or any therapies. In this condition, I-10 to I-15 category codes should be used for hypertension controlled. Next one is hypertension uncontrolled, which means any untreated hypertension or it is not controlled for any therapeutic conditions. In that cases, we have to give I-10 to I-15 category codes for this uncontrolled hypertension. And hypertension crisis, I-16, hypertension crisis, hypertension emergency, hypertension urgency, or unspecified hypertension crisis. The next topic is pulmonary hypertension, I-27, other pulmonary diseases code we have to give. For secondary pulmonary hypertension, we have to assign I-27.1 and I-27.2 codes. Code also any associated condition with this or any adverse effect of any drugs or toxins, we have to code these conditions also along with the secondary pulmonary hypertension code. The code sequencing is fully based on encounter of admission or encounter of patient visit, except for the adverse effect of drugs and toxins. This is the part 1 of chapter 9 coding guidelines. If you are having any doubt, please do comment in the comment section or do mail me in the personal email. I'll give my mail ID in the description box. Please go and check it out for that. I hope you like this video. If you like this video, please like, comment and share. If you are a new viewer, please subscribe our channel and click on the bell icon right beside to subscribe button. Then only you will get immediate notifications for our channel updates. Thank you from Bhuma Devi Chandrasekharan. The next topic is hypertension with the CKD, in which we will cover the guidelines such as the hypertension with CKD code is I-12. When both hypertension and the condition is classifiable, then we have to assign this code for I-12, and again we have to provide N-18 category codes if the CKD is present. And the CKD should not be coded with hypertension if the provider is mentioned as CKD and hypertension is not related. CKD means chronic kidney disease. So, if the provider mentioned as CKD and the hypertension is not related, it is unrelated, then we should not code CKD along with hypertension. The next one is appropriate code from N-18 categories used with I-12 category codes to identify the stages of CKD if it is related with the hypertension. So, if the hypertension and the CKD is related, then we have to give I-12 codes and the appropriate N-18 category codes to identify the stages of CKD. And if it is if both hypertension and CKD is not related, unrelated means, then we should not code CKD along with the hypertension code. The next one is hypertension, heart and CKD. Both these three are present, hypertension, heart disease and chronic kidney disease. These three are present, then we have to assign the combination code I13. Whenever the combination code is there for any disease, then we have to, any condition, then we have to assign the combination code first. We have to go for the combination code. If heart failure also present, then we have to add additional code from the category I50 to identify the type of heart failure, and appropriate code from N18 category to identify the stages of CKD. Why we are not using I12 and I10 codes means, in the I10 category includes notes contain such individual codes for hypertension, of heart disease and CKD should not be used separately, cause I11 and I12 is included in I13. Okay, because in the I13 includes notes contains the codes like this, like I11 and I12 codes we should not assign separately because it is included in I13 code. It is a combination code for hypertension, heart and chronic kidney disease. So we have to go for combination code I13.